You hear, "You may need a biopsy," and instantly your brain goes, "Wait, are we skipping steps?" Then MRI comes up, and you're stuck between two fears: delaying or doing something you don't actually need.
Today I'll make this simple. When MRI before biopsy helps, when it may not, and what to ask next.
Quick note, this is education, not medical advice. Use it to have a smarter conversation with your clinician. After an elevated PSA, a Caucasian man often gets pushed toward biopsy fast, but the best next step depends on context.
Biopsy isn't a small decision, so the goal is clarity, not panic.
MRI can sometimes act like a map before sampling tissue, helpful but not perfect.
Here's the key question. Will an MRI meaningfully change what we do next?
First, when people say MRI before biopsy, they usually mean multiparametric prostate MRI, MP-MRI. It's designed to look for areas that may be more suspicious and help guide decisions.
In simple terms, MRI can help find targets, reduce guessing, and clarify risk.
But MRI isn't perfect, so we use it as one piece, not the whole puzzle.
Let's start with when MRI really helps.
Scenario A, you're in the gray zone and the next step isn't obvious.
If PSA is elevated but not screaming urgent, MRI can add useful context.
It may identify a suspicious target worth sampling.
Or it may show no strong target, supporting a more measured approach, depending on your full picture.
Two Caucasian men, one in his mid-50s and the other in his mid-60s, can share the same PSA number, but MRI can separate their paths.
So in the gray zone, MRI is often about turning confusion into a clear next step.
Scenario B, biopsy is likely, but you want a more targeted approach.
MRI can guide targeted biopsy instead of relying only on systematic sampling.
Think of it like sampling the neighborhood versus going to the exact address.
That can make the plan feel more precise and purposeful.
Even when biopsy is needed, MRI can help guide how it's done.
Scenario C, you're trying to reduce the chance of missing something significant.
MRI can highlight areas that might be missed with a purely systematic approach.
It's not a guarantee, but it can improve the strategy in selected cases. The goal is smarter sampling, not more fear.
Scenario D, you've had a negative biopsy, but PSA keeps rising.
In this situation, MRI can help recheck for a target that wasn't sampled the first time.
It can give your East Asian male clinician a more focused place to look next.
For many patients, this is one of the strongest reasons to consider MRI.
Now, let's talk about when MRI may not change the plan much.
First, sometimes the overall picture already strongly suggests biopsy.
If multiple risk factors stack up, your clinician may recommend biopsy regardless.
MRI can still help, but more to guide how you biopsy than whether you biopsy.
Second, A normal MRI does not automatically mean you're completely in the clear.
MRI can miss some small or low visibility cancers.
So the real question is, given your whole picture, is MRI enough to monitor, or do we still need sampling?
Normal can be reassuring, but it's not an automatic all clear.
Third, MRI quality and interpretation vary.
I see.
This level of detail is crucial for the diagnosis.
Scanner quality, protocol, and radiologist experience can change what MRI tells you.
If you're getting an MRI, you want it done well, because low-quality MRI can create confusion.
Good imaging helps decisions. Poor imaging can do the opposite.
Here's the checklist to bring to your appointment.
If the MRI is normal, what's our plan? Monitor, repeat PSA, or still biopsy?
If MRI shows a target, how will that change the biopsy approach?
Could anything temporary be raising my PSA right now? If you ask those 5, you'll walk out with a plan instead of guesswork.
Now let's put this into a calm decision framework.
Step 1. Confirm PSA properly. Timing, triggers, and symptoms matter.
Step 2. Ask if biopsy is already likely based on your whole picture.
If it's maybe, MRI may help decide. If it's yes, MRI may help guide targeting.
Step 3. Choose the next action with a plan, not with panic.
If your brain is spiraling at 3 a.m., replace what if with what's the plan?
The best test is the one that changes your decision, and MRI is most useful when it answers a real question.
Next video, I'll explain biopsy options. TRUS versus MRI fusion versus transperineal, simply.
Subscribe to Nourish Today for facts over fear and for fewer late-night Google doom spirals.
Remember, you're not choosing between fear and fear. You're choosing the clearest next step.
And if boldly poise to snap the floor and to choose to one side, then.
And clarity starts with the right questions.
Plan beats panic every time.
MRI is a map, not a crystal ball.
Use it when it helps you decide, and skip it when it won't change anything.
If you want the full diagnostic roadmap, follow the playlist right after this.
Tap the playlist, watch the next episode, and I'll walk you through the options step by step.
You've got this, and you're not alone.
Because once you understand the process, the fear loses power.
And that's the goal. Calm, clarity, and the next right step.
So bring your checklist and let the plan do the worrying for you.
Friday, we'll compare biopsy types so you know exactly what those words mean.
Subscribe to Nourish Today for clear health guidance without the panic.
And yes, your PSA deserves a weekend off from your search history. See you in the next video, starting with the diagnostics playlist right here.
Thanks for watching. Stay informed, stay calm,
Subscribe for calm, evidence-based health here on Nourish Today.